Ladies and gentlemen, this is a story that came out on October 7th, 2018, and this is the Daily Mail. Anytime men in high numbers are running for fertility treatment, that tells you even they know they have a problem. Now, they conducted a study here in the US and over in Spain to look at males with infertility problems that are seeking treatment. And that has gone up 700% in 15 years. So you can't tell me that these groups that are struggling to have children are not aware of this. In order for it to be sevenfold or 700% higher over 15-year period, they know, ladies and gentlemen, they know they have a problem. And this is not all men. This is not all men. The only men they focused on in this are the Western men from Europe and the US. Because really, there's only one group impacted by this. I mean, it's the truth. So, male fertility, obesity, smoking, and exposure to plastics are to blame for a huge drop in sperm quality, scientists say, as rate of men seeking treatment soars 700% in just 15 years. That's a sevenfold increase. Sevenfold. That's a lot. And that just goes to show you there are a lot of men impacted by this. So they're showing over the last 15 years, the sperm quality that they found in the US and Spain has plummeted, according to this research. And the study was conducted at fertility centers between 2002 and 2017. So that's how long they did this research. This one is a little different from the other articles that I read you. This one, they focused a lot more on the infertile men. Before they were comparing the fertile men to the infertile men, and showing you the differences. In this one, it's mainly driven by infertile men. So they found that the number of men seeking treatment went up sevenfold from 8,000 to 60,000 in that time period that they did this research. And they also found that there was issues with the sperm quality. Okay, and so these men with low sperm, they require IVF treatment in order to conceive. So they talk about this researcher, Dr. Ashley Teagues. She will be in Colorado at a conference giving her findings, and that's on Monday. And this is what she told the Daily Mail. And she said the drop in sperm quality is mostly driven by, this is what she's saying, environmental factors like smoking, stress, obesity, and exposure to chemicals and plastics. That's what she is saying the sperm count is attributed to. Maybe it is for some males. Maybe it has something to do with genetics, and it's tied to those environmental issues, because this certainly is not happening to all males. I mean, all of us are breathing in the same environment and using the same plastics, but we're not having the same issues. I'm just saying. The study comes a year after experts in Israel and the US sparked alarm with shocking data that sperm counts among men living in Western countries had fell by 59.3% in the last 40 years. That is a huge drop. That's very significant. That's way more, that's over half. That's over half, and they're talking about in Western countries. Western countries, so they're talking about Europe, America, Canada, you know, this is what they're talking about. They had a nearly 60% drop in sperm in the last 40 years. And these are all of the nations that are well below fertility rates that would sustain them. Okay, so they looked at subfertile males, and they did not look at fertile ones like they did in all of the other studies. And they're labeling this a public health concern, because that's how things are labeled. Just like the drug epidemic is a public health issue. Everything becomes public health when, I guess, when it affects certain groups, it's public health then. It was a crime during the crack epidemic. Okay, so according to this doctor, and this study was done in New Jersey, by the way, and it's called Dr. Teagues, and she's at the Reproductive Medicine Associates of New Jersey. And she did this research, and this is her findings. So we're going to get into what she found. Total motile sperm count has shown to be more predictive of outcomes for pregnancy. Dr. Teagues explained, it's also correlated with embryo development and expansion routes. So we want to know if total motile sperm count was effective. And if it is declining, then what are the implications? So this data, which I told you before, she's presenting at reproductive type of conference that she's having. Okay, so this is considered a normal sperm count of 20 million per milliliter of semen is considered normal. The men that were that she did her research on, they range between 5 million and 15 million, okay, of sperm, milliliter per semen. So these men were definitely below the 20 million count. So those are the ones that qualify for what she says for IVF, for treatment for infertility, the ones that have a harder time conceiving. The data collected by Dr. Teagues and her colleagues showed that the number of men reporting sperm counts under 15 million has soared, and the number of men with a normal level above 15 million has steadily declined. But you know what? I don't fully believe that, because if that were the case, you would hear more of a problem from other groups outside of what they call Western men. We know who they're talking about. Since 2002, the rate of men at the two clinics, now the test was conducted at a clinic here in the US, and a clinic over in Spain. So that's what they're talking about when they say the two clinics. And they said it turns out that they have a normal sperm count above, most of the men that went to these clinics had a sperm count above 15 million, had dropped. But once they made up 85% of infertility patients, now, just 15 years later, they make up 79%, a significant drop. Okay. So meanwhile, the rate of men with much lower sperm count is climbing. It means the number of male-related IVF cases is set to soar. Well, 700%. That's a lot. We weren't expecting to find that the trend of sperm count declining has real treatment implications, Dr. Teagues told Daily Mail. So they're saying, ladies and gentlemen, the average age of Western men that are getting treatment for fertility problems is 36 years old. That's very young. You would think a 36-year-old man normally should never have a problem um, getting a woman pregnant. But that's the average age of the male that they're finding with fertility problems. So that just go to show you when it comes down to infertility, it's just as much the male as it is the female being barren and using excuses like, oh, we're going to wait until later. It's none of those things, ladies and gentlemen. It's just what I'm telling you. It's fertility problems. Our studies support a lot of the other literature that shows environmental factors like plastic and smoking and obesity are big ones, Dr. Teague said. We know obesity is on the rise and it does affect sperm quality. It increases the risk. Okay, so it also increases the offspring. So, in other words, daddy is infertile if he gets a woman pregnant after getting treatment. Baby will be infertile or have a very low sperm count throughout their life. So the males, ladies and gentlemen, that you are looking at today, the Western males that you're looking at today, are less fertile than their forefathers. They are less fertile than their forefathers. I will never forget the article I did, the video I did that said not only are they less fertile, they are more female than their forefathers. So that tells you right there, in order for them to be more female today than their forefathers, then it's got to be low testosterone there too. All connected, all connected. Dr. Teague said the factor that the study involved two continents is key. So Europe and America. It shows the issue is a global concern. Did y'all hear what I said? So that would mean the US, Europe, Australia, no matter where they are in this world, they are impacted by infertility problems. And it's got to be true. I did a video, if many of you remember, on an Australian couple where the man in that situation had to get treatment in order to get his wife pregnant. She wasn't having the problem. He was. So I believe it, that is very true. It is very global. Next, she hopes to look at larger groups in other countries. That could give you a clue about what the environmental factors are in each country. So as you can see, it's showing you a steady decline from 1970 all the way to 2010 in this chart. Okay, and it shows last year research pictured this chart showed the sperm counts have fallen nearly 60% among Western men since 1973. Wow. I think the reason, ladies and gentlemen, why they come out with this stuff because they know the fact that their population is declining, that people know it's noticeable now. I don't know about where you guys are in the country, but where I am, it's noticeable. It really is. You can see certain things going on. Like here in New Jersey, there's jobs that they're having a hard time filling. Okay. The public schools are no longer predominantly white. And this ain't no white flight. Maybe years ago it was. That's not the case anymore. It's really, truly an issue with their numbers. Um, I remember back in the 80s, I had read a story that by early 2000, the children would be more minority than white, of other ethnic groups. And the white children, it would be less of them in the country. I read that as far back as the 80s. And we see that as true. When you look at the census, there are less white children. So they're bringing a lot of this out, ladies and gentlemen, because it is now noticeable where it might not have been so much a few decades back. The researchers of last year's study at the Hebrew University and the Icahn School of Medicine at Mount Sinai in New York examined 250 studies on sperm count conducted between 1973 and 2011. By reviewing the previous studies, the researchers were able to get a long term global perspective and compare sperm among Western men to that of people in other parts of the world. Since 1973, sperm concentration for Western men have fallen by more than 52%, declining by 1.4% each year on average. Overall sperm count fell by 1.6% each year, resulting in a cumulative decline of nearly 60% in the last 40 years. The research come after the US National Center for Health Statistics for Centers for Disease Control and Prevention data arm announced in July of 2017 that fertility in the US had reached an all-time low. Birth rates among American women have been falling for decades, but took a sharp downward turn beginning around 2010. Okay. When they're saying Western nations, they're talking about people of European descent. Okay. Some of you that are new to my channel, that's who they're talking about. By 2016, the sperm fertility rate in the US was only 62 live births per every 1,000 women. Fertility uh, specialists emphasize that male and female biology are approximately equal responsive for any reproductive issues or failure. So they're seeing a lot of flaws in the females of Western descent, and they're seeing just as many flaws in fertility problems in the males. So right now, the infertile females and infertile men are about the same in number. Taken together, the recent data on sperm count and birth rates in the US do not bode well for the stability of the American population as measured through sometime called the rate of replacement. Yes, we know that there are more deaths than births among the Western descent people. More deaths than births. The average is 2.1. And many of these folks are below. Now they're saying 1.8. I have seen it as low as 1.6. This article is saying 1.8. Okay. So there are less fertile men than there were decades ago. As the baby boomer generation ages, we know they're your elderly people that you're looking at now. Those are your baby boomers. Okay. All of the populations that came after the baby boomers are small in comparison. So they have a real problem going on, ladies and gentlemen. You got the younger generation that are dying from drugs at a high rate, and you got the elderly population that's also dying in high rates because those are your baby boomers. The elderly whites are the last biggest population these Western folks have in the US. Once they die out, all of these other generations that came after that are small. And they know this. And it has everything to do with why Trump was elected. All of the problems that they're having. See, this is what happens when you wear your emotions on your sleeve and you let everybody see that there's clearly something wrong. You didn't go on those public rants for no reason. When you start reading stuff like this, ladies and gentlemen, you understand why they're ranting so much and jumping on the phone and calling the police and doing all of the things that they're doing. They're having some serious, serious problems. And when you read stuff like this, it's problems they cannot change. They have thrown tons and tons of money at this drug epidemic, and they still can't turn it around. And I'm telling you right now, even though it's 700% more men going for treatment, it will not make a difference. It will not make any difference. And that's what they are struggling with. They are struggling with things that they absolutely cannot change or stop from happening. They can't do nothing about it, y'all. All they can do is make all these attempts. But when you start looking at it realistically, they can't change this. Okay. Now, this is what they're saying, and I'm telling you, it's all in the genetics. Some explanations for the decline in female fertility have suggested that women are simply choosing to have fewer children or none at all. No, it isn't. No, it isn't. No, that's not the factor. That's what they want you to believe. Later in life, as they pursue high degrees of education and more time consuming jobs. But the changes in male fertility are entirely biological in nature, which may be a cause for great concern. And I'm telling you, that is the main reason for it, ladies and gentlemen. It's biological. It's biological for the women, too. It's not I don't feel like having a baby right now. No, they're not all doing that. Many of these couples are trying hard to get pregnant and they can't do it. They can't do it. They can't do it. Ladies and gentlemen, I can see this even when I go out, okay? In the area that I live in, whenever I go out to the store, even when I go to other communities to the store, because sometimes I do, depending on what I'm looking for. Even when I go over in those communities where it may have higher white people in that area, when I go in the stores, do you know who I see pushing baby strollers? Black and Latino women. I see Black and Latino women with the baby strollers. When I go in the stores, I see mostly white people with teenage children. They got teenagers. I more likely see them with teenagers than I do see them with infants and toddlers. Where when I see even Asian women, I see still Asian women pushing the strollers. But when I go out and I see babies, they're usually Black or Latino babies. When I even walk in a store, now I'm just telling you what I see with my own two eyes. Maybe where you are, it might be different. I'm sure it is different depending on where you're living in the country. But please tell me what you think, ladies and gentlemen. This is mind blowing to me. A 36-year-old man seeking help, fertility treatments, and it's gone up 700% in 15 years. That is huge. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.